Fighting heart disease. The overall goal of this lesson is to teach the community about the prevalence of heart disease, how to screen for it, prevent it, and how to treat it. The specific audience I intend to reach with this lesson are the members of my community who are most susceptible to heart disease. This includes men and women between the ages of 40 to 60. By the end of this lesson, my audience should be able to provide a teachback regarding the information learned throughout this presentation about the prevalence of heart disease, examples of heart disease screenings, and they should be able to make a plan to reduce their chance of developing heart disease. So what is heart disease? The term heart disease encompasses several types of heart conditions. The most common type of heart disease in the United States is coronary artery disease. Coronary artery disease is caused by plaque buildup in the walls of the arteries that supply blood to the heart and the rest of the body, otherwise known as the coronary arteries. Plaque is made up of cholesterol and other substances that deposits in the arteries, causing them to narrow over time. This eventually blocks the flow of blood that can lead to a heart attack. What are the symptoms of coronary artery disease? Symptoms include chest pain or discomfort, weakness and lightheadedness, nausea, cold sweats, pain or discomfort in the arms and shoulders, and shortness of breath. Over time, coronary artery disease can weaken the heart's muscle, which can lead to heart failure. The symptoms of heart disease are the same as the symptoms of coronary artery disease, but cover a more general set of heart conditions. This includes a heart attack, arrhythmias, and heart failure. Our first objective is to teach the prevalence of heart disease. Heart disease is the leading cause of death for men, women, and people of most racial or ethnic groups in the United States. One person dies every 37 seconds in the United States from cardiovascular disease. That's about 647,000 Americans that die from heart disease each year. Heart disease costs the United States about $219 billion each year, which includes things such as cost of healthcare services, medicines, and loss of productivity due to deaths. This slide shows the percentages, of all deaths that caused by heart disease in the year 2015. In this chart, we see the heart disease rates of death in adults that are 35 years and older between the years of 2014 and 2016 throughout the United States. So who is most at risk for developing heart disease? Medical conditions and lifestyle choices can put you at a higher risk. If you have diabetes, are overweight, have an unhealthy diet, or are physically inactive, or you consume excessive amounts of alcohol, you are at a higher risk for developing heart disease. The three most common risk factors are high blood pressure, high cholesterol, and smoking. About half of Americans have at least one of these three risk factors. High blood pressure is often called the silent killer because it usually has no symptoms. The only way to know whether you have high blood pressure is to measure your blood pressure. You can lower your chances of heart disease by lowering your blood pressure with lifestyle changes or medications. Not getting enough physical activity can lead to heart disease. It can also increase the chances of having other medical conditions that are risk factors, including obesity, high blood pressure, high cholesterol, and diabetes. Drinking too much alcohol can raise your blood pressure levels and increase levels of triglycerides in your blood. Women should have no more than 1 drink a day, and men should have no more than 2 drinks a day. Cigarette smoking can damage the heart and blood vessels. Nicotine raises your blood pressure, and the carbon monoxide from cigarette smoking reduces the amount of oxygen that your blood can carry. Exposure to secondhand smoke can also increase your risk for heart disease, even for non-smokers. Although genetics can play a role in heart disease, more often it is the commonalities in your environment that increase the risk, including lifestyle choices such as smoking and unhealthy diets. Now let's talk about our second objective, which is to provide you with some examples of screening tools. The most basic way of screening for heart disease is to take a look at the risk factors and warning signs that we have talked about in the previous slides. If you have any of these risk factors, further conversation with your provider should be initiated. A simple blood test can look at your complete lipid panel for a screening. This checks components in your blood, such as cholesterol. Your healthcare team should test your cholesterol levels at least once every 4 to 6 years. If you have already been diagnosed with high cholesterol or have a family history of the condition, you may have to check your cholesterol more often. A simple blood pressure measurement can also be taken as a screening device. The CDC recommends your blood pressure be measured at least once every 2 years if you have never had high blood pressure or don't have any of the other risk factors. If you have been diagnosed with high blood pressure, your healthcare team will measure your blood pressure more often to make sure you have it under control. The frequency of blood pressure screenings will vary based on your readings and medications. You should take notes of readings once they're measured at your doctor's office, at a pharmacy, or at home. If you're at high risk for heart disease, you already have symptoms, your doctor may want to order some tests to rule out or diagnose coronary artery disease. These cardiac screenings include an EKG, an electrocardiogram, or an echocardiogram, or an exercise stress test, a coronary angiogram, or a coronary artery calcium scan. Our third objective is to teach some prevention methods or tools. How can I prevent heart disease? Preventing heart disease starts with healthy habits, such as changing your diet, exercise, promoting weight loss, and smoking cessation. Taking charge of medical conditions can also help prevent heart disease. In an earlier slide, we talked about measuring your blood pressure. A healthy blood pressure is considered less than 120 systolic and 80 diastolic. This is often read as 120/80. Taking control of cholesterol is another step you can take. Your ideal cholesterol levels will depend on your risk factors and your heart health history. If you are at higher risk for heart disease, have diabetes, or have already had a heart attack, your target levels will be below those of people without these risks. Stress management is another prevention technique. Limiting sources of chronic stress and anxiety are important, as well as developing healthy coping mechanisms. The topic of a healthier lifestyle may seem like a general one. It starts by eating healthy foods, exercising regularly, avoiding foods that are high in trans fat and salts, stopping smoking, and starting weight loss. If you have already had heart disease diagnosis, it is important to talk with your doctor about medications you're on, your exercise routine, your typical diet, your family and personal history. Also, make sure you keep note and mention any symptoms you may be experiencing, including heart racing, dizziness, or lack of energy. Is there a cure for heart disease? Heart disease cannot be cured or reversed, but many of the symptoms of heart disease can be relieved with medications, procedures, and lifestyle changes. If these methods fail, coronary interventions or bypass surgery may be used. Regardless, heart disease requires a lifetime of treatment and monitoring. It's so important for you to take charge of your overall health now before a diagnosis may be made. This is especially true if you have a family history of heart disease or conditions that can increase your risk of heart disease. Now that you have a little more information on the topic, you can start to take care of your body and your heart. For more information, please visit these resources. Thank you for your time.